Hello and welcome everybody to Help Is Not on the Way. Um, I am Josie Pickens. I am the program director for Up in Movement. I'm so glad that you all could join us here today. This conversation is going to focus on how the reproductive justice movement and activism around reproductive justice connects to the work of Upend and the family policing system and abolishing the family policing system. We have some fantastic panelists here to bring this conversation to light today. We have Dr. Kim Baker. Dr. Kim Baker works full-time in public health as an assistant professor and the assistant dean of practice at the University of Texas Health Science Center at Houston School of Public Health, where she researches topics related to reproductive health and justice and public health practice. She also manages Own Every Piece, which is a multi-partner system level intervention to increase access to contraception, for women in Harris County, Texas. Thank you so much for joining us, Dr. Baker.
Thanks for having me.
We also have Maya Pendleton here today. Maya Pendleton has been a part of the Up In movement since its inception. She currently works as a researcher and writer for the Up In movement, focusing on how we abolish the family policing system, the harms of the current system to children, families, and communities, and the world we will build post-family policing. Thank you so much for joining us, Maya.
So happy to be here. Thank you.
And we also have Kay Matthews. Kay founded the Shades of Blue Project in 2013, shortly after the stillborn death of her daughter, Troya Simone. As a fierce advocate of Black birthing individuals across the world, Kay has worked on and supported key pieces of legislation to help improve their birthing outcomes and experiences. And Kay has become an expert when we're talking about maternal mental health, which we'll be getting in as part of our discussion today.
Hi, everyone.
So thanks, everyone, for joining us again. Thank you to the panelists for coming along to be a part of this conversation. The reason that the Up In team decided to put this webinar together is because we wanted to have a conversation about, as I said earlier, the intersections between the work that those organizers and activists are doing around reproductive justice and the work that organizers and activists are doing around family policing system abolition. We have been seeing many cases in the news, both recently and somewhat recently, where we are seeing Black families being separated, newborn babies being pulled away from their mothers, how those families are being impacted, how the health system is harming Black birthing people, children, and families all together. And so we thought that this was an important time to bring this conversation to light and to remind people that although when we see these cases in the news, we often think that they are isolated events, it's quite the opposite. This is what the family policing system does. So often, too often, this is actually the status quo. We started thinking about this when we thought about the Jackson family right here in Texas, in Dallas, Texas. I'm sure many of you are familiar with the case of the Jacksons and Mila Jackson, particularly a newborn baby that was forcibly taken away from her parents, Tamicia and Rodney Jackson, a little over a week after she was born during an at-home childbirth with a credentialed midwife. Like many Black women, there is a great deal of fear around, again, trusting the healthcare system, giving birth in hospitals. And so this family decided that they wanted to have a natural birth at home. The Jacksons were still being responsible and made sure that they brought their new baby, Mila, in to see their longtime pediatrician, and a pediatrician that had taken care of other children that they have, in order to do, a newborn checkup to make sure that everything was okay with Mila, with the baby. Upon that visit, the pediatrician that was treating Mila and that was supposed to be helping the Jackson family care for her realized that Mila had jaundice, and essentially went through a back and forth with the parents. The parents wanted to have their birthing team and their midwife take care of Mila. The pediatrician felt that Mila needed to be admitted to the hospital. The Jacksons decided to be autonomous in their choice to treat their child and did not bring their child to the hospital. The pediatrician called the Dallas-Fort Worth Child Protective Services to intervene. There were police involved, which is why we call this the family policing system. It's because, the child welfare system and the traditional policing system often work together to harm families. Rodney Jackson was arrested. Mila was snatched away from her mother's arms, taken away during a time where she should have been bonding with family, where she should have been breastfed, and was away from her family for a good while, a couple of weeks. And if it were not for the national attention that this case received, and those who are working in reproductive justice, those who are working to abolish the child welfare system, which we at UpN more adequately call the family policing system, I'm pretty certain that there would still be an issue with Mila being with her family. And then that case made us think about the case of Saisha Mercado, which some of you may be familiar with in the news. Saisha Mercado is of American Idol fame. She was a contestant on American Idol, and back in 2021, brought her 1-year-old son into a local hospital in Florida. So, because she was concerned with his nutrition. Her son was having some challenges transitioning from traditional breast milk feeding to now solid foods. And so just like with the Jacksons, Saisha Mercado and her partner were bringing their son in for help and to make sure that her son was healthy. One of the doctors at the hospital, who seemed to regularly and erroneously report cases of child abuse to child welfare officials, ended up, of course, reporting Mercado. She ended up also having her child snatched away. And later, when she gave birth to her daughter, had her daughter snatched away from her as well. Another case is more recent with Bianca Claiborne and her partner, who had was in a car on her way to Chicago through Georgia and got stopped in Tennessee. Because of this traffic stop, her 5 children ended up being taken away from her. One of those children being very young as well. And so I bring up these 3 cases, and these are just 3 cases that have kind of been in the news, and I'm sure that there are more cases that have been in the news. We see that this is a common issue. We see that this is something that we absolutely need to have public conversations about. These are cases, as I said, got wide news coverage, but this is something that happens every day. in the child welfare system, in the family policing system. And we're here to talk about why, and also how we can help Black birthing people um, in a non-carceral way, and what it looks like to build communities of care. As many of you know, Up in Movement focuses on abolishing the family policing system, because we at Upend believe that this is the only way forward. Very often, when we're having conversations about abolition, many people focus on what it means to dismantle systems. But part of the abolition conversation that we always need to bring forward is that while we are thinking about how to dismantle this system and really all systems that are connected to this system, we are also thinking about what it means to build the communities of care so that there is no need for us to even think about these systems. So these systems have no reason to exist. So I'd like to begin the conversation to talk a little bit about why and how Black birthing people are surveilled, regulated, and punished many times throughout their pregnancies and parenting experiences. I just brought up 3 cases. As I said, we know that this is a common practice. This is something that happens all the time. These are not anomalies, but in fact are common experiences. Maya, do you want to begin that conversation and talk a little bit about how and why this happens?
Of course. So, I think to understand why this happens, we really have to ground ourselves in the history of the country that we live in and the ways that Black families were never respected, never seen as families, never seen as autonomous families, really from the time of slavery, right? So, Black families were separated from each other. Black mothers and fathers and in between aunts, uncles, what have it, were not allowed to stay together. And that was for economic benefit mostly of the institution of slavery, but also punishment, because it was very understood that taking someone's child has such a profound effect on someone. And the grief and pain that comes with that is so profound that that was used as punishment. So we can think about the history beginning in slavery. And then we can also think about the eugenics movement in the United States and in the ways that Black parents were told or not told that they were going to be sterilized, and how that often happened without their consent. And this is happening mostly to poor Black people in the South. And then so fast forward, now we have this system, the family policing system, where Black communities, parents, and families are always under scrutiny. And I think the example of the Jacksons is such a good one because there's so many things happening here, right? So one, there's this whole medicalization of pregnancy where we're told that you cannot use a midwife. Like, that is not an appropriate way to have a child, right? And if hospitals are a site of harm for not only a Black person giving birth, but also for a family who might have their child taken away by a doctor. If hospitals are a site of harm, but you're told you can't use a midwife, where are people to go, right? And so there's all these ways that doctors, the police, the family policing system work together to tell Black families that they are inadequate and that they cannot take care of their children. Parents are often drug tested at the time of pregnancy, whether that is consensual or not, oftentimes, and that is also used as a way to evade that family autonomy. So I think that, throughout history, we have really seen building blocks about what we have now, which is really a system where Black families are being torn apart by these systems and being surveilled by these systems. Being surveilled means that you are assumed to be criminal, assume that you are harming someone. And so we see that these systems, the policing system, the prison system, which is a whole nother conversation about how we cannot have reproductive justice in a world that has prisons, because parents cannot be separated from their children, unable to raise them in a world where reproductive justice is fully realized. So we have all these systems that are working together to surveil and eventually harm and separate Black communities and Black children and families from their communities.
Thank you so much, Maya. That so many layers to that and so much information there. Maya actually has a wonderful essay paper that is on the Upend website that talks specifically about reproductive justice and how it connects to this work that we do at Upend. So you should definitely take a look at that on the website to get more information about these things that Maya has brought up. Dr. Baker, do you have something to add to what Maya has offered?
Oh, absolutely. I mean, Maya covered a lot of that historical framework. I just wanted to add, coming from a public health background, just how much public health surveillance was weaponized as a tool of submission, right? Coercion, force, power over. And so, just in the history of health and the public's health, and so as Maya mentioned, the eugenics movement, this was public health federal policy for a good 60 years in our country, surrounding, sterilization, and then also who had access, and who was considered unwitting people, right? Who had the freedom to reproduce and parent. And so, just thinking about how we got here, right? This was intentional of these systems for us to be here.
Mm-hmm.
And so we have to always think about that, and from, I think from my positionality in public health, like that is a core piece of our work in terms of, when we're working with doctors and nurses and trying to train them to talk about how harmful some of their approaches are and some of their assumptions are and some of their practices are. Well, this is how so many of them are still continue to be trained, right? And so there's so much work to do to dismantle that.
Thank you so much. And Kay, you are someone who works with those who organize around taking care of birthing folks, Black and Brown birthing folks, right?
Mm-hmm.
You have a great deal of experience if you're thinking about it through the lens of those birthing folks and those families.
Mm-hmm.
What do you want to add?
I think when we talk about the system in such an undertone of the context of a system that was not designed for us, and so how can it take care of us, right? But we need to go a little bit deeper. We're doing some surface level things, but this thing is deeper. And when we don't know what we don't know, this is when the most harm is done to us. It's kind of like that feeling you get in your gut, like, I don't think this is right. It probably is not. So when you're caught up in a system that, again, is not on your side, we unfortunately are going to be the ones to save ourselves. So we got to know how to advocate for ourselves. Unfortunately, we have to know the right things to say to be able to escape from situations like this, because this thing is huge. You and I talked about earlier before hopping on about the magnitude of what the repercussions of this happening to these families is. It's a continuum. It's not just, oh, your baby got taken away and then you fought and then you got your baby back. It's all of the mental health that goes into it, the trauma that will exist for a lifetime now. So a moment in time is now going to be something that has to be a continuum that you have to get support for. It's not going to go away overnight. People are not going to understand that. And so you're going to be constantly like in this battle, right? It's like, damn, this one thing happened to me right here, but I'm still battling these other things while this thing is either still happening or it's no longer hot topic or the news, right? But the damage that is done is what's so much concerning for me, how we take, again, a moment in time and turn it into this lifetime of things that we now have to deal with that were unnecessary from the start, that have now led to other issues and other complications. Because, again, mental health can consume you. It's more than, okay, her baby was snatched away, and I say snatched, stolen, snatched away within a week of the baby being born, that bonding that is no longer there, that mom's mental health. She may have been fine in the postpartum period, but you have now sent her into this postpartum depression spiral that may have started as anxiety. And it's like a continuum. So we don't even see all the time the magnitude of what these one instances turn into a lifelong of things. And so a system that is not designed to care for us is a really in-depth statement.
Yes, and I echo that and say that even when we're talking about mental health and the challenges that will come with it and the harm that it's been done to the mental and emotional health of a family like the Jacksons, for instance, and we're not just talking about um, the parents, we're also talking about what that type of separation will do for, to baby Mila. Like you
Yes.
said, this is like something that is continual. This is something that is cyclical. And also, when we see birthing folks who are dealing with mental health issues, especially from certain communities, we know that that also is going to be surveilled and punished. We know that that also is going to push these families even deeper into the system many, many times. And so, as you said, it is just a circle, a circle, a circle. And I think a lot of times, as Dr. Baker said, a lot of healthcare professionals and those who are working in the healthcare system really think that they are helping families, but in actuality, through mandated reporting, are often harming families. And we're going to talk about, like, what does a non-carceral approach to that look like? But first, I want to delve a bit into, again, talking about the intersectionality of how these conversations that are happening in the reproductive justice movement now, particularly around abortion bans and Roe. We are here in Texas having this conversation. So, this is something that is very important to discuss. How abortion bans, family policing, and systems of surveillance and punishment kind of intersect. The limitations of Roe and how Roe being overturned pushes more Black birthing people into precarious and dangerous situations and pushes them again further into these systems. Dr. Baker, would you like to begin by talking about that a bit?
Absolutely. That's exactly what we're seeing, and we'll continue to see more of. There's studies already showing that in southern states in particular, where there were bans on abortion and now total bans on abortion, the increase of maternal mortality for Black women is significant compared to states who did not have these abortion bans. And so death for sure, and then this policing, morbidity, other negative health outcomes, leave Black families more at risk here. And then we also know that fully, even when abortion was fully restored in the United States, it wasn't fully restored and accessible for all Black people. Dealing with that, right? And so I work in the world of contraception and the coercion that still exists in terms of contraception and women who may be in the carceral system and being forced with, methods that they didn't sign up for, right? And so not having autonomy over their own bodies, even when they enter into the system, quote unquote. It's so unfortunate, this forced pregnancy, coerced pregnancy at a greater scale that we will begin to witness. And the impact and the fallout from that. And that our community of care, safety net system, whatever we want to call it, it is not prepared. We are not prepared for what is happening. And it's frightening. It truly is frightening. And there's so many people in situations. And yes, we're in Texas, right? And so we're starting to hear and see, things in terms of, and Kay can speak a lot to this too, the anguish and the anxiety that women are facing who are forced to bring a baby into this world, right? And not feeling like it's on their own terms. And, if they're already system involved and what that means, right? Just because of unjust policies that they may have experienced prior to being pregnant.
Right.
And so yeah, and so we're not ready. We don't have the community care that we need at this moment.
Yes, and you mentioned Kay and how Kay can speak to this. So I guess we'll ask you to continue on this point.
It's exactly what Dr. Baker is saying. Unfortunately, but fortunately, and I say that twofold because that's what it is. Unfortunately, we have women who are coming to us because they don't know what to do. Fortunately, they have come to the right place because we can help them to navigate what that is. Right? It's still having the bodily autonomy in some capacity. Um, what we don't think about, or what lawmakers don't think about, is the consequences to the laws that they put into effect and how these things actually affect everyday folks. And so we've had an influx of what do I do next? And then I always say it's the audacity for me of these larger organizations who have been pushing for so long, keep your baby, do adoptions, this, and the third. Now they're overwhelmed. Be careful what you ask for is the thing. So you got what it is you asked for, deal with it. Now we're scrambling because there's not enough support, like Dr. Baker says. There's not enough support because we're still looking at abortion as a taboo. Like, can we get serious right now? Like, you put these things into play without knowing the magnitude of what you have caused. And it's a ripple effect, right? So before Roe versus Wade was turned over, we had SB8 here in Texas. So we already had our backs up against the wall. And so then it became like a worldwide thing. And I was just like, well, people, we already had like something in play like this. So now you understand it and people start to panic, right? But when we start to panic, we do things that cost us more than we can come back from. And that's what we're seeing now. So we out here talking about mortality, morbidity rates being what they are now. In a year or so, we'll be having a completely different, they'll then call it an epidemic, right? They don't get it yet, but it's here because you're forcing folks to make decisions that they would make a decision, but that decision is no longer theirs to make, right? And so this is what they're dealt with. And when our backs are up against the wall, you only got a split second to make the right decision. And sometimes it's not even that easy. So we've already seen the increase of what we are going to be up against. So let's just, again, revisit this conversation a year from now, and we'll have many stories. I don't know why we have to curate environments to have the stories of the trauma to then go maybe 5 years from now and try to fix it. Because we got the trauma stories to go with it. Now it's a problem. It was a problem when you created the issue. So they've created the issue that we now as a community have to deal with. But it's so much. It's a lot. It really is. Again, we treat abortion as taboo. It's just like the stigma around mental health. There's this stigma around abortion and how you can care, how you can treat, what should be done, what shouldn't be done. We talk about reproductive justice, man. The lens needs to be widened. Like it's so much more to it, but it's definitely an injustice for someone to be forced to keep a pregnancy that they don't want and can't even figure out how to navigate in their everyday, and now have to navigate for an additional human. At what cost? That's where we sit right now, and that's the questions that we're asking ourselves daily in this work. This is the cost. We see it every day, and it's people's livelihood, and not to mention their mental health that goes along with that leads us to do other things. So they have not yet seen the magnitude of what's happening right now, but it's coming because you can't hide from it. But you created this problem, though.
Absolutely. This conversation about how we need to widen the lens when we have discussions about reproductive justice and exactly what that means. So often we kind of stop at contraception, we kind of stop at access to abortion. We oftentimes forget, and we were talking about this earlier before we came into the webinar, is that part of reproductive justice and this movement towards reproductive justice is understanding that, part of that means that people are supposed to be able to give birth, have healthy births, be able to have healthy children, be able to raise their children in healthy environments, be able to stay connected with, children and families. And that is just something that we know is going to be an issue as we move forward. So when we talk about abortion bans, when we talk about people no longer having access to safe abortions, we know that that means that people are going to be forced to give birth, as both Dr. Kim Baker, I don't know why I said Dr. Kim Baker. I like saying your whole name. Dr. Baker and Kay have said, we know that this means that there are going to be more children and families who are going to be pushed into the family policing system as a result of what's happening. Maya, do you mind speaking about that a bit?
Yeah, of course. I think, when we talk about abortion bans, the most ironic part of it is it's not as if we live in a society that truly cares for children and their parents, right? And so many people choose to have an abortion because they feel like they can't take on another child. Most people have abortions, have kids already. They feel like they can't handle another child. They feel like they're not financially ready for a child. And so when you are a Black person bringing a child into the world and you feel like you're not financially ready and you might live in poverty, those are all situations that are going to push you towards family policing. We know that, right? Families enter the family policing system because of poverty. I think the other thing that is important to think about here is the way that, so I'm in DC. I know you all are in Texas, but I'm in DC, and DC offers abortions later than most states do, right? But the thing is that there's all these ripple effects of these abortion bans. So clinics here are overloaded, and they're having to tell people that, we can't do your early term abortion because we are focusing on people who are much further along in pregnancy. So at the same time, people are actually being pushed out of places where they are seeking help because of the ripple effects of all of these abortion bans. I would also say that, I know when someone is serious or not serious about reproductive justice and abortion when we start talking about the police, right? So people will be up in arms about overturning Roe and all this stuff. And on the same coin, you flip the side and they'll say, let's give more money to the police. Well, who do y'all think is going to be enforcing abortion bans? And when people are seeking an abortion or have a miscarriage, who is carrying them to jail? I mean, it's like, let's be serious. So whenever that conversation comes up, it's like, if you don't understand how connected the surveillance of pregnancy and abortion is to policing, it's like, I don't know where to go from there, because the police are such an integral part in all of this surveillance and all of this policing, and the ways that people will be punished and in some cases sent to jail for, again, not only an abortion, but also miscarriages, right? Also things that are completely beyond people's control. And so to live as in a society where you are told, one, you must have a child if you are to become pregnant, but two, if you have that child and maybe you weren't ready, we're going to send you to a coercive system that will, like Kay said, have ripple effects for generations of families. That's generational trauma that families carry. And, I just think about how organized we need to be and how mobilized we need to be, and how we need doulas, how we need abortion doulas, how we need networks to care for people who are both, seeking abortions, but also how do we care for people that have children and need help?
That's so good, Maya. And I'm going to keep you on the mic here and keep you on the hot seat, because I think all of these things that you're saying kind of lead into another question that I have about how abolition and an abolitionist vision connects to this conversation that we're having. Because I said earlier, we always at Upend quote Ruth Wilson Gilmore, who says that, abolition is presence, not absence. And as we said earlier, Dr. Baker, Kay have said, hey, we are not prepared. Our communities are not prepared for this crisis, for this epidemic that is on the way. as a result of abortion bans, as a result of everything that is happening around Black birthing people during pregnancy, during birth, and what happens after. So I would really love for you to talk a bit about why abolition and an abolitionist vision is so necessary to consider and to adopt in times like these, in this moment.
Yeah, well, I mean, I understand abolition as an analysis and a praxis that gets us closer to the world that we're talking about, right? So we're talking about caring for people, we are talking about mental health, we are talking about support, we're talking about making sure that people are clothed and that they're fed and that they're whole and that they're happy. And I think that abolition helps us get there, right? So, like I just said, the police are going to be the ones that are enforcing quote unquote illegal activity with these abortion bans. So we can't understand things like reproductive justice without also having an understanding of prisons and police. And like Dr. Baker said, coercive contraception, all of these things are interconnected and they are happening together. And I think so often our movements become so siloed, right? So it's like, okay, you're a RJ person, you're a family policing person, you're a prison police abolitionist, but all these systems have to go, right? For Black communities to truly be healthy and whole and autonomous, which is super important, and to be able to make the decisions they want to make about their lives and about their families and the type of communities that they want to live in, all of these systems have to go. And I think that, you know, when we talk about getting rid of the systems, it leaves so much space for us to be able to generatively think about what is the type of world that we want to live in, you know? How do we want to take care of children in society? And I think that so many of us are doing abolitionist work already and are operating like we live in a post-policing society already, you know. Okay, I think about your Shades of Blue project, you know, supporting people through mental health struggles, gathering people, holding, you know, virtual things, in-person things. That is abolitionist work. That is what it looks like to care for one another and to live in a society where, you know, we're able to say to our neighbor, I need something, and they're able to provide it. You know, you have a community garden, people come and get food. So I think that for me, abolition just opens up so much possibility with the world that we have to live in and allows us to think not always on the defense, which is important because we need to have the defense ready, right? But it also lets us think about, like, what do I want to build and what do people need and what can I provide to them?
I love that answer so much. So good, Maya. Dr. Baker, I'd like for you to speak about what non-carceral responses look like in situations like with the Jacksons, in situations like with Saisha Mercado, where these are Black mothers who are going to healthcare providers for help to make sure that their children are able to be and stay healthy, and end up being punished for it. What would a non-carceral response what would that have looked like with both cases?
You know, that question, the unfortunate part of this, the reality of it is these families were doing their part. They
Right.
were practicing autonomy. They were trying to make decisions. They were trying to raise their, you know, little ones in a healthy environment, doing all the things. But on the flip side, on the other side, because of the surveillance, because of the assumptions, because of the bias and racist views that intersect across race, class, and gender for so many of these providers, right? They make these decisions and they're connected to the family policing system. And so I think what it looks like is that when I say we need more communities of care, right? There's research that says, you know, we need our providers, whether it be doctors, nurses, midwives, doulas, community health activists, mental health first aid that looks like us, and that is connected and that gets the investment. Let's talk about that. Let's talk about who gets funded and the face of the work that is valued, who can respond to the trauma and the needs, and who could surround families in the work. Because honestly, we've been resisting since we've set foot in this country, right? Resisting coercion, resisting these laws and forced reproduction and all of these things. And it's when we come together and try to create community, right? Where's the investment? Where's the sustainability? Why aren't our solutions valued or considered evidence-based or what have you? What the next term you want to throw out? And so that's what I kind of, the work that we are looking to push more is like when we begin to really invest in these solutions and build up these communities of care and say that there's value in this, right? And we can solve this if we invest that money there. That has been a struggle. That has been a struggle. There have been co-conspirators who look like us, who get the talking points and then go over to the other side with the huge investments and continue to perpetuate everything that we continue to see that's more harmful. And so, there's so much in this funding and investment that needs to happen so that we can continue to grow, this new reality or this liberated freedom so that we can truly live in this RJ type of space.
Mm-hmm. Oh, I'm sitting with all of that. That's so good. So rich. And, it really boils down to anytime that people ask me, well, what does the world look like without police? Or what does the world look like without family policing system? And I always say, we know what that world looks like. Go to any affluent community. Go to places that are well-resourced. You go to affluent communities, you don't see police, there who are militarized. When you go into affluent communities, you don't see families being separated because there are issues within that family. You see resources. You see people getting help. You see families staying together. So what I always answer when people ask me that question is, the real question is, why do we feel some people deserve that reality and deserve that world and why other people do not? That is always how I answer that question. Kay, if you don't mind, can you add to that? Like, first of all, what does a community of care look like? Like, how do because we want to talk about building that, right? We want to talk about building communities of care so that we can work towards dismantling these systems. As you said earlier, we can't do that until we have things established in the community to help those who are struggling in the ways that we know that they struggle. So tell us, where do we start? We can start from pregnancy, from the birthing process, wherever you'd like to go. Talk to us a bit about what does communities of care look like for Black birthing?
It actually starts before we become birthing folks. It's the education and the know-how. It's what to look out for. It's all of those things. So it's the education before we even get pregnant that is important. But whatever stage in which you come in, whether it's before, during, or after, education is a key piece. But we just can't say education. We also have to equip the people with the tools. So it's just like saying you need to come to class, but you don't have no book, right? And so if I'm teaching from the book, how are you learning if you have no book? And so when we talk about education, we also have to equip the people with the tools. One of the biggest things also what a community of care looks like is respecting everyone in it and what that individual person needs and wants, not one over the other. The two go hand in hand. I can want what I want for you, but what do you want for yourself? What is it that you need for yourself? So we have to start listening. And so when we talk about bodily autonomy and what that means, I could be talking to a community member and they never even heard the words bodily autonomy. But if I told them, what is it that you need for yourself to feel comfortable? That's a different way of saying bodily autonomy, right? You will have to be able to care for the person that's standing in front of you, even if it's 25 different people. That's how we have to see it. This is what I talk about is widening the lens. It's that continuum of care that we don't often implement. We talk about it in theory, but we don't know how to implement it. And so when we think about training and how we engage, that is how we have to start doing more of the things that we talk about. That's how we're going to build a community of care. Yes, we can take care of ourselves, though, but that's why they have doctors, nurses, midwives, doulas, right? That's a support system. And so, what does it look like for us all to collectively work together without respect? It looks like nothing because it's not going to work. Without seeing me, it again looks like nothing because you don't even see me. You can physically see me without seeing me. It's taking the time out to see what I have going on. What is it that I need? What is it that I want? How is it that I will allow you to help me? Because some folks will not allow you to help them, so don't force it. But if you're having a conversation with them, you'd be able to learn and know that. And so what I see out here in community work being done by others is that Black folks are a hard population to take care of and to deal with. I call BS on that. It's because you don't see us, you don't understand us, and you've already put us in a box where it's like a one size fits all approach, and you're not doing anything other than what you know. So that's what that checkbox is. You're just going down the list and checking off the things and saying, I did all these things and y'all should be good, but we're not. And so as we continue to think about what does a community of care look like, we got to look at ourselves first, because sometimes we have biases as well. And so how we serve people, how we look at people, how we don't look at people, all of those things become factors. And so you first got to respect folks. You got to see them and then offer them the support that they both need and want. That's how we start. It's the simplest things that become the hardest sometimes. But because practice makes perfect, we got to at least start practicing. We're not even practicing. So
this is absolutely so true. I was having a conversation with a group of students a couple of weeks ago, and we were talking about these students who are part of a university that is in an area that is being heavily gentrified, and talking about what it means to like build community with the folks that they want to help. And the first thing that I said was that if you're going into these communities, you have to go in not looking at those people as a problem to be solved, but looking at those folks as like, wow, somehow you have survived this thing. Somehow you have survived the death and destruction that has been at your door. You're surviving the displacement. You are surviving all of these things. And really, wow, how powerful is that? How heroic is that? How much can I learn from you? Instead of approaching those communities, as I said, as a problem to be solved. So I think that goes right into what you're saying. It's this kind of cultural competency and respect and recognizing people's humanity and full humanity, and understanding that a lot of ways that we look at folks and define things like families is rooted in white supremacy and is harmful, and thinking about what redefinition looks, what it means to, first of all, ask folk how they define things, how they think about things in order to be able to fully communicate and have a compassionate approach to helping them. So absolutely 100% correct. And this conversation is just so good. I don't want it to end, but I know that we do have some questions from the audience that we're getting ready to get started with. So I am ready for the questions. Hopefully you guys have some good ones. All right, one of the questions that we have here, is it Lady? I hope I'm pronouncing your name correctly, Woodard. Thank you for sharing that. I was just wondering how you all see the intersection of mental health support and birthing practices and experiences for Black women. I guess we can start with UK in answering that question.
It's the overarching piece. So often we treat mental health as an and or part of the conversation when we should honestly be starting with it. What we can't continue to do is fight for what is happening for people without asking them how they feel about what has happened to them. We want this to be a collective effort, right? Because the fight is the fight, but a collective fight is completely different. But when folks are seen and heard in the midst of, because the pain is the pain, right? So what these families have experienced and what they have been up against, that's their pain, right? But what can we do in a collective way to be able to address it? And so it's talking about it together and not one over the other, because so many folks are struggling with their mental health. And it's not that there's not resources, so we can't lend that way that there's no one out here to take care of them. That's not true anymore, because folks are out here. It's how do we get to them? Are they actually offering the care that is needed? Are they offering patient-centered care? Like, that is it. You can be a mental health professional, but are you actually taking care of the person that is in front of you? So all of these things go hand in hand. If we keep skipping over it, we continue to have this problem that is growing out of control. And we're calling it this and we're calling it that, but we're not calling it what it is. And I'm gonna
Yes,
pause because I could talk about that forever. Because it's an issue, man. It's
it
this
is.
thing that's happening to us. And we're skipping over it because it's hard,
Yeah.
instead of pausing and figuring out why is it hard. And that this may be that one thing where we got to call people in, right? I don't know everything, but I know some numbers that I could call in, right? That I can call and be like, can you help me out? Can you assist me? Can you do this? So now we got to get into a way of calling people out, so I can call you in because I need you to help me with this thing because it's growing, right? So the more we look over it and we don't see the tie-in or the connection, the bigger the issue starts to grow. And then we have another issue that is bigger than the community and bigger than what we can handle. So, yeah.
Mm. Yes. You have anything to add quickly, Dr. Baker?
No, I was just going to add, I agree with everything Kay is saying. I was just going to add in terms of experiences for Black women and mental health, Black birthing people in general, pushing past thinking about this stops a year after someone gives birth, or this stops in this kind of like defined postpartum period, and how much support care is still needed years beyond, right? If we're thinking about this RJ model and parenting in a healthy and sustainable environment. And so what that support looks like, so many times we think, hey, she's gone on, she's doing her thing, she doesn't need support now, she's got it, kids are in school, or just kind of conversations, just how we think about the strength of Black women in particular, and kind of that narrative. And so I think extending mental health support beyond the birthing experience and just into the future, and thinking about the care that's needed there.
Thank you so much. I see a question here from Bill Betancourt. Bill is one of our founding members of UpIn, so we're so happy to see you in the audience, Bill. And Maya, I'd like for you to answer this question because I know you're going to have a good answer. Bill asks, can you speak about racial capitalism and the need for addressing that as part of the abolition movement to enable the vision for communities of care moving from surviving to thriving?
Yeah, of course. Well, I think understanding, again, I like to ground myself in history, and understanding how racial capitalism has been the impetus for so much of the oppression that people are experiencing today is essential to understanding how we built that apart, right? So, there's money involved in this, right? People go to prison, there's money involved. People are oppressed. There's a whole industry involved in making money off of people's oppression and poverty, from high interest rates. I mean, I could go on and on about the ways that people in poor neighborhoods are actually exploited for their poverty, for capitalism. But I also think that the important thing to think about here is that the reason why food, housing, shelter, and all these basic needs are so scarce is because they are commodities in our society, right? And so people don't have what they need because you have to pay rent. If you can't pay rent, you don't have a job, you don't have a home. So capitalism really is a thing that is undergirding so much of the oppression, the poverty, the scarcity, the precarity that people find themselves in, because of the fact that everything is evolving around money and profit motives, you know? So I think in abolition, we have to understand, if we are to build a new society, that means that we are building a new society where housing is no longer a moneymaker, a commodity for people, where food is free and plentiful. So these are all the things that I think that abolition instructs us to build and to think about when we're thinking about what do we tear down and what's the society that we want to build after that.
Thank you so much, Maya. And I think we have time for one more question. And I know Dr. Baker and maybe Kim, you are signing off. But before you do, really quickly, Dr. Baker, I think so. This comes from Misty Scott, I'm seeing here. So, as a mental health provider, how do I move away from the old mindset of reporting? Right? We talked about mandated reporting. That is what has happened in all of the cases that I mentioned. And move towards the gathering of supportive services when the systems are so against me and mothers. Like, how do we tackle this issue of mandated reporting? How do we move towards support?
Well, if we genuinely want to support people and we want to help people, we're not reporting them. So I think that it starts there. If you ask yourself, how can I help this family? How can I help this person? That answer does not lead to reporting them to a carceral system, you know? So I think that I know that it's complicated for professionals that are social workers, that are, you know, mental health professionals, and I used to work in a situation where I was a mandated reporter and I took the training. I never reported anyone. I don't know if I should say that, but I didn't. But, you know, I think that if you're really asking yourself how to help someone, and you are being recommended to report people, then you have to take a step back and be like, well, what do they actually need? And where I'm reporting them, can they provide that help? And the answer is always no.
The answer is always no. I feel like that is a great place to stop when we're thinking about, you know, mandated reporting and realizing that so often we are actually harming families when we think that we're helping them through mandated reporting. We're thinking, oh, well, if I offer this report, then it's going to help this family get services. We don't understand that this system is not actually doing what it says that it does. It actually isn't a helping system. Help is not on the way, right? Oh, I thank you all so much for being a part of this conversation. I wish this could be a whole day's worth of talking about this, but you know, we're on a time limit. Thank you, Dr. Baker. Thank you, Kay Matthews. Thank you, Maya Pendleton, for being here with us today. And thank you all for tuning in. Thank you for the comments. I've been trying to stay focused on what is happening in the conversation, but also peeking over to all of the wonderful things that you all are adding so richly to this conversation. Do you all have any type of social media handles, any place that folks can find you online if you want to share any of that? Maya, do you want to begin?
Yeah, of course. You can find me at MV Pendleton on Twitter.
All right, Dr. Baker?
Yes, Prof. Kim Baker on Twitter. So that's PROF Kim Baker.
And then the Shades of Blue Project all the way across the board. So Shades of Blue Project on all social media.
All right. And make sure that you're following Up in Movement, both on Twitter and on Instagram. And visit our website, upinmovement.org.
Thank you so much.
All
Bye,
right,
everyone. Thank you.